Well, when you have bad breath, you reach for gum or mouthwash,
Yeah.
but should you also reach for the phone, maybe call your dentist? I was just saying, maybe people on the receiving end of your bad breath are like, call your dentist.
Yeah.
Joining me now is Dr. Arlene Asante with First Class Smiles to talk about what your mouth may be trying to tell you. Good morning. Thanks for joining us.
Good morning.
You have a beautiful smile, by the way.
Thank you.
All right, so have you noticed, I know we were talking about during the pandemic, people with their masks on got a better idea of what was going on.
Yes.
Have you noticed folks are more interested in finding out what's going on, what's behind that, or no difference?
Unfortunately not. I think that people are so afraid of going to the dentist. The dentists have a bad rep.
Why is that?
I don't know. I think it's pain, feeling like when you're in the chair you don't have no control. And it really deteriorates people from going to the dentist.
Yeah.
But I think in 2023 we should really have oral health as one of the most important things in our lives.
And we should mention, you've probably seen it all, so there's nothing you should be ashamed of, right?
Yes.
I think a lot of folks, maybe they're a little embarrassed.
Yeah.
But you all, I'm sure, aren't judging. You just want to fix the issue, get to the bottom of it.
Absolutely.
All right, so let's talk about the 5 signs that something could be wrong.
Oh, absolutely. Bad breath. I do believe that a lot of people just use mouthwash to try to substitute their bad breath. But when we have bad breath, something is going on. That means there is a high dose of bacteria in your mouth and it's causing your gum health to decrease. You might even have some bone loss, and maybe even cavities also are some of the issues that are causing the bad breath.
Wow. So,
Yes.
I mean, it's not just a nuisance, the bad breath. It could point to something more serious. What are some of the solutions? What would you do at the dentist for something like that?
Oh, so your dentist is going to do a full evaluation and check the health of your gums. Through us doing our evaluation, we'll be able to tell you if you have periodontal disease, which is one of the common diseases that is overlooked, that patients do not realize that, yes, you have a disease in your mouth. You have a disease of the gums. You have a disease that is perpetuating and causing you to have bad breath.
And you want to be proactive. I mean, these are your teeth.
Yeah, absolutely.
So what can you do to prevent this from happening in the first place? What should you be doing?
I think coming to your dentist consistently, making it a part of your overall health. I think that a lot of times we think about our physical body, but we neglect our oral health. We keep it separated, but it is a part of your body. Just like we go to the doctor to check our high blood pressure and diabetes, we should also be checking to make sure that our teeth is in proper order.
So brush your teeth twice a day?
Yes.
Flossing?
Yes.
What else?
Brushing for 3 minutes and more.
3 minutes, okay.
Yes, and trying to get every area of the mouth, coming to the dentist every 6 months. And sometimes, depending if you have periodontal disease, you will have to come a little bit more frequently.
Gotcha.
But the most important thing is not allowing fear to stop you from taking care of yourself. I think in 2023, it is about taking care of our overall health. I see so many people empowering themselves as far as physically going to the gym. And then also now a lot of people are going to therapists, so they're caring about their mental health. But what about our dental health? We need to go to the dentist and take care of that as well.
I love that. How can folks get a hold of you? We got a wrap here. How can we get in touch?
I am located in Bethesda, Maryland, on Wisconsin Avenue.
You're right down the street,
Yes, we're right across the street. Please call our office. We're taking new patients, 301-264-5015.
All right, first up is making the call.
Yes.
So we appreciate
and getting
you coming
over
in.
the fear.
Yeah,
Yes.
just got to do it, and then your mouth will thank you for it. How about that?
Oh, yes.
Dr. Arlene Asante, thank you so much for joining us this morning. Appreciate it.
I appreciate being here.